Damaged veins in your legs left untreated can cause serious problems down the road. Here to tell us the signs and symptoms of vein disease and discuss the best treatment options before it's too late is cardiologist Dr. Rajiv Agarwal with Modern Heart and Vascular Institute. Good morning.
Good morning, Deborah. Go Astros.
Go
Yay.
Astros, absolutely. All right. I'm sure there are a lot of people who are watching from home because they can't get up and walk those city blocks to get down to that parade. When it comes to arteries and vein disease, if you have a problem with that, your entire body is impacted.
Yeah, your whole body has thousands and thousands of miles of blood vessels. Arteries take blood from the heart and go to the toes and arms and wherever, and veins bring them back. So very important to have excellent circulation, Deborah.
Yeah, like most situations, if you catch it early, it's easier to treat, but even advanced cases you've been able to take care of. But a lot of people probably dismiss those symptoms in the beginning because they think it's just, a muscular issue, or I'm just tired, or it's just age. Let's talk about some of the arteries' poor circulation symptoms.
Yeah, the artery symptoms, the key factor is that they happen with exertion. So if someone has symptoms in their legs with walking, then it's more likely arteries. So you get fatigue, tiredness, numbness in the legs, but with exertion. Whereas with the veins, you get symptoms at rest. So if you get swelling, varicose veins, fatigue in the legs, Charlie horses, cramps, just any achiness in the legs, but more at night or while you're sitting or standing, it's way more likely to be veins, and it's all preventable and curable.
Yeah, let's talk about some of the risk factors. Let's start with arterial disease.
Arterial disease, like any blockages you get in any of the arteries, including the heart or legs. So you have diabetes, blood pressure, cholesterol, smoking, stress, obesity. Those are the most common ones for arterial disease.
All right, and venous?
Venous is more sedentary lifestyle. So people that aren't moving a lot, secretaries, flight attendants, teachers. Hey, a lot of teachers today because schools are closed. They know what I'm talking about.
Yeah.
They get achiness, fatigue with standing or sitting. And the risk factors being overweight, sedentary lifestyle, and birth control medications also do damage to the veins.
Yeah, all right. To diagnose this, it's actually pretty easy, so people don't have to worry about that. It's non-invasive. They come in, you sit down and first of all talk to them, get a good record of what's going on, but it's very easy to diagnose.
Very, very easy. Some people are afraid that we're going to be doing too much for them. No, no, no. We talk with them. We figure out, is it more likely to be arterial or venous? Then you get a ultrasound of the legs, which pretty much clinches the diagnosis. Of course, we're examining the legs, looking for those varicose veins, spider veins, just any skin changes. A lot of people even have wounds and ulcers that they've gone on for months untreated, and we can make them go away with the proper
And Dr.
treatment.
Agarwal, this is such an important point to that. I have talked to so many people who've said, yeah, I went to my dermatologist, or I went to, and it's not a dermatological issue. That's kind of the symptom of the problem, but you, as you always say, let's get to the root of the problem so that you don't have those symptoms. All right, what are some of the treatments? I know there's like the roto-rooter. We joke about the roto-rooter procedure, which can be very quick and easy for people.
Yeah, that's for the arteries. So if you have blockages in your arteries, we have you come in, outpatient procedure. You come in, you go home the same day. We can open up the blockages with literally a roto-rooter type of device. It's called an atherectomy device. You can clean up the blood vessel, open it up, and then you go home. For the vein disease, it's very different. That's done in the office. You don't even have to go to any hospital or facility. There are multiple ways to fix veins. It could be heat, it could be glue, it could be foam, but initially we start with compression stockings. The veins get bigger and we bring the veins back to normal size with the compression stockings. And a lot of times that's all it takes, but sometimes people need procedures and they're done in the office.
Yeah, one of the other things that you treat that can be a result of vein disease is restless leg syndrome. Also a lot of swelling. I have a woman who I met, she is so upset that she can't wear her go-go boots because she's like, I go to zip them up and they won't zip because my legs start swelling in the middle of the day. But you can also address those issues.
Yes, actually my mom had swelling and she had some restless legs and we fixed her veins. This was a few years ago. She has not had an inch of swelling since then. So these symptoms can be gone away. You, like you said, you find the root cause of the problem, you address it, you make it go away, non-surgical, done in the office, insurance covers for it. And it's a life changer. It's like having a car with 4 new tires put on. your life just changes immediately. Within a week, you're walking better, your balance is better, but you're sleeping better, you wake up refreshed, you just feel good.
Yeah, yeah. So your mom feels good now, but is she wearing go-go boots?
She feels great, and she's been rooting on the Astros.
All right. Get her a pair of boots, orange boots on top of that. Thank you, Dr. Agarwal.
Thank you, Deborah.
All right, to book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com or give them a call at this number, 832-644-8930. Again, that's 832-644-8930. They accept most major insurances, including Medicare. Appointments fill up fast, so contact them today. And by the way, they have doctors who are fluent in Spanish as well. It only takes a minute to schedule a vein screening, and it could save your legs and make getting around a lot more comfortable.